Hello there. Welcome to your annual wellness exam. My name is Calliope, and I have some of your previous records here, but I just wanted to ask you a couple of questions to double check, if you don't mind. Very first one, I know you filled out the forms online. We really appreciate that. So, do you have any sort of new health developments, either in your own life or any new family diagnoses? We can see if maybe there's any genetic history component. This could be anything like a surgery, or it could be an acute condition, chronic condition, anything that's been new in your health. Okay, that's good to hear. Excellent. And any new medications or supplements at all? And any changes to allergies at all? Anything new? Any different reactions? Okay, excellent. So that matches up with what you had put down. We just like to double check and see if maybe there's something that maybe needs a little bit more explanation, and then we can chat about that. So I want to start by grabbing my stethoscope. So let's pull this bad boy out. And if you don't mind, I'd like to just listen to your heart and lungs. Okay, so we're going to start with the heart. We're just going to put this right here, and we'll listen to each of the valves. So we'll start with the aortic valve, and I don't need you to do anything special. Just take normal breaths here. Good. And the pulmonary valve. Good. And the tricuspid valve here. Excellent. And the mitral right in here. Okay. Those all sound good. So let's go ahead and take a listen to your lungs. I'm going to start at the lung apices, the very top of the lungs. I'm going to have you take a deep breath in and out. Deep breath in and out. That's it. Deep breath in and out. Good. Deep breath in and out. Deep breath in and out. Good. Deep breath in and out. Okay. Can you lift your arms so that I can listen on either side of the chest? Okay. Oh, right in here. Deep breath in and out. side here. Deep breath in and out. Wonderful. Put your arms down. Now if I could just have you turn around so that I can listen to your lungs from the posterior chest. Okay? Alright. We're going to do that again. Deep breath in and out. Good. Deep breath in and out. Deep breath in and out. Deep breath in and out. Deep breath in. Last row here, deep breath in and out, and deep breath in. Wonderful. So that covers all the lobes of the lungs, of which you have 5. 3 on the right side, 2 on the left side. You need room for your heart. So, I am now going to take a little listen to your carotid arteries on each side and listen for any bruits or audible heart murmurs. So for this, I'm going to have you take a deep breath in and hold so that I don't hear the air rushing in and out of your throat. I could just have you take a deep breath in and just hold that. Good, and exhale. Deep breath in. Hold. And exhale. Good. And lastly, I want to just take a little listen to the temporal arteries right in here, okay? So you don't need to do anything different. Just breathe normally. Good. And let's see, right here, this side. There we go. So, last little bit I want to listen to is the abdomen. So, again here, just going to have you breathe normally. And it takes me less time, but more areas to listen with the abdomen. I'm just going to take a little journey around the 4 quadrants and do a little listen. Good. There we are. So, quite a bit of the stethoscope to start us out. Here we are. Now, let me just jot that down. We have quite a few notes there. We have the heart, the lungs, the carotid arteries, the temporal arteries, auscultation. Auscultation, as well as with the abdomen. There we are. Now we are going to do a little jump, and we're going to come back to the head here. So I would like to take a little look, rather, at your head and scalp. I have a little tool that can help me just to see a little bit better. So we have this light, which gives me just enough that I can look at the skin of the head, look for lesions, any dry patches. I'm just starting here at the hairline. Good. Part the hair a bit and look around. Good. Let me know if anything feels abnormal, painful, sensitive, anything of the sort. Anything at all. Good. That's it. Just getting a good look all around here. Good. Now I am going to take the opportunity to do a bit of palpation here. So I'm just going to feel the contours of the skull. Make sure that the lumps and bumps that should be there are, and that there aren't any that should not. Good. Okay, that's excellent. Let me take just a little feel at some of your lymph nodes here. Underneath the jaw. And along the neck. Good. And just down here along the clavicle. Good. No distension. Nothing palpable. Nothing out of the ordinary. So let's take a peek at your eyes. I am going to grab a fairly bright light here. And I'm going to start by just putting it underneath the eyes so that it doesn't really affect how your pupils are sized. Doesn't really change them too much. So just look straight ahead, and I'm just taking a peek at everything there. Good, so good distribution of eyelashes and eyebrow hairs. We have clear sclerae. Irises are bright and clear, and pupils are round. And the conjunctival tissue, from what I can see, just right here. Let me just pull it. Can you look up for me? Yes, that's just a nice pink color. I'm going to pull up here. You look down. Good. Other side, just very gently pulling up. Yep. Nice and pink. Pulling down. You could look up. Yeah, that looks great. Okay. So, can you look at my nose here? Alright, and I'm just going to very slowly bring the light in and then back out. We can look at how your pupils respond to the light. I should constrict with the presence of more light. We don't want to see them dilate instead, a bit of a paradoxical reaction. Good, and just keep looking at my nose here. Good. Just trying to make sure that every reaction is correct here. Good. Now, can you keep looking right here? And I'm just going to bring the light. One eye and then the other. And again, we're looking for a paradoxical reaction where the pupil dilates instead of constricts. Good. Okay, very good. Now, I'm going to give your eyes a little bit of rest for a moment. And I'm going to have you focus on these two fingers, okay? I'm going to move my fingers around, and I want you to watch them using only your eyes without moving your head, right? Okay, just go ahead and follow these fingers, okay? And they're going to move a little bit randomly, sometimes coming in, sometimes going out. I'm just watching the tracking. Good. Very good. Okay, so tracking is smooth. Let's do something a little more structured. So keep watching my fingers here. I'm just going to bring them to one side, up, down, good. Other side, up, down, excellent. And up, down, okay? Up, down, down. No lid lag, that's good. Keep following my fingers. Diagonally up, diagonally down, diagonally up, diagonally down, diagonally up, diagonally up, diagonally down, diagonally down. Good. All the way in and all the way out. In, out, in, and out. Switch these fingers out, and in, out, in, out, and your eyes responded wonderfully to each test. Let's see, cranial nerves. 3, 4, 6, intact, and I do have a note here, so it looks like you have seen an eye doctor recently. Is that correct? Good. So cranial nerve 2 then. Looks like it would be intact from that. Pupils are equal, round, reactive to the light. P-R-R-L. Let's take a little peek inside the ears. So, this one can be a bit persnickety. There we go. So, I am just going to have a little peek inside your ears, if you don't mind. Let me know if it is painful or sensitive at all. Okay, there we are. There we are. Alright, so it looks like we have a clear ear canal with an intact tympanic membrane and like a normal amount of serum in here, normal coloring on the skin, on the tissues here. We have the cone of light as well as the red light reflex right there, or rather the red light reflex. That's a fundoscopy. We have the cone of light and we can see the tip of the malleus through the tympanic membrane. That came a little too easily. Red light reflex. Alright, very good. So, we'll just repeat that on the other side. This time, ideally, without the red light reflex. So, I'm just going to pull the ear up and back, and then we will, there we go, just look into the ear. So, just going to get a little more comfortable here. I don't want to accidentally bump into you at all. So, tympanic membrane is the correct color, as well as the surrounding tissues. It is intact, no bulging, perforation. The canal is clear, and our landmarks are present, cone of light, and tip of the malleus, not the red light reflex. Okay. Alrighty. So, have you had any issues with your ears, with any hearing issues, pain, itchiness, sensitivity, anything of the sort? No. And let me see. So, I do also have in my chart here that you have recently had a spatial hearing test. Yeah? Okay. So, our vestibulocochlear nerve is intact, and upon otoscopy, we saw our landmarks, ear canals were clear, Tympanic membranes look great. Good. So, why don't we take a little peek at the upper extremities? So I have a few tools that we'll use here. I want to start with the goniometer, which I have a few here. These are little simple tools here that we use to measure the angle as far as a joint can go, the range of movement in degrees. So depending on the size of the goniometer, like this big giant guy, for example, compared to those other ones, we have some landmarks that we line up, and we can measure the amount of degrees that a joint can open to. So we can look for restricted movement or hypermobility. So with this one, I'm going to put this side along the upper arm, and I'm going to have the other one along the lower arm. This goes at the elbow. So if I could just have you open your elbow and just keep it open, and we'll see how much of an angle that creates. So this lines up here, up there. Okay, what do we got there? Okay, that's well within normal limits. Let's go ahead and do this on the other side. So this lines up with the elbow, upper arm, lower arm. This one is a good, is that about 6 degrees more open? So let's just compare here. So they're both within normal limits, however that is quite a bit. So we have the difference between, we had about right here, this angle, and right here. So I'm going to note that down. Do you have any pain or restriction in your elbows? No. Okay. So that might just be your baseline. 56 degrees. The elbow. And if I could see the wrist, we can measure both the flexion and extension. So I'm going to put this at the wrist. Can I have you just put your hand like that? This lines up with... Okay. Good. And if I could have you just put your hand back here. Good. Okay. That's within normal limits. And other hand goes back and then forward. Okay. All right. I am pleased with that. Let's get out our reflex hammer. Today we have the Degerin hammer here, a nice heavy one. So if I could just have you relax the arm and just let it hang loose, let your leg take the weight of it. Good. And I'm just going to come around to the back so we can get the triceps reflex here. So just feel a couple taps here. Okay. And biceps reflex. I'm going to put my thumb, the crook of your elbow here. And that went well. Muscle responded well there. Now, other side. Let the arm just relax down. Let it go loose and limp. Okay. And triceps reflex first. Good. Biceps reflex. There we are. So, let me just take a little peek at your hands and your arms. If I could have you show me your elbows. We'll look for any plaques here, of which there are none there. Okay, and can you show me your hands face up? Okay, no contracture, no palmar thickening, thenar and hypothenar muscles, good bulk to them, and the skin is of normal tone, texture, and can you flip them over for me? Good. So, nails are healthy. The nail beds are nice and pink. The tips of the nails are normal off-white. No cholesterol deposits. No staining. Good. And the joints, normal, non-swollen. Are any of these tender as I press on them? Okay, non-swollen and non-tender. Good. And normal tone, normal texture, little dry along the cuticles, but it's that time of year, and a little bit. Just gonna press real quick on each of the nails, and the capillary refill is less than 2 seconds each. Excellent. So let's go ahead and just do a little bit of palpation on the abdomen, and we're gonna start with just one hand here. And tell me if any of this feels tender at all or painful. Anything? No. Okay. I'm just gonna feel, so over here we have spleen. We have the liver and the kidneys here. Good. Okay. Now I'm going to get in a little deeper here, and I'm going to use both hands. So, let me know again if anything is painful. It might be a little uncomfortable here. All good there? Excellent. So, let's take a peek at your nose, your mouth, and your throat. Coming back up for a sec. Can I have you just tip your head back? Very good. So, take a little look inside the nasal passages. Any issues with your nose at all? No? Okay, good. And can you open your mouth? Alright, I just want to look at your teeth. And the tongue. Can you lift your tongue to the roof of your mouth? Good. Okay, that looks good. And can you stick your tongue out? say ah for me? Okay. Cranial nerves 9 and 10 intact. That's great. And the throat wall. Smooth. Normal coloring. Non-irritated. Good. So lastly, we have your legs. Let me grab our big goniometer and we'll match this up with the upper thigh, or the upper leg rather, the knee and the lower leg. So, right here, can you go ahead and kick out your leg as far as it'll go? Good. Okay, and that's right where we want to be. And can you bring it in as far as you can? Okay, that was good. Other side. Kick out as far as you can. Good, and bring that in. Okay, so these are all within normal limits. And just going to jot down extension. We'll bring back our dudgeon hammer, and I am going to tap on your knees here. So if I could have you just relax the legs, just like you did with the elbows, the arms. Okay, just let them hang freely, and you'll feel a few taps here. Good. Other side. Excellent. So let's take a peek at the legs. So like the elbows, the shins are going to tell us a good amount. We want this area to be smooth. And then if you wouldn't mind just putting one foot up here. Good. So let's see if we've got any pedal edema. Nope. And top of the foot looks good. I'm going to press down on each toe here. Those are all normal. You see the bottom of your foot? Okay. No wounds. And color looks good. A couple calluses. Nothing crazy. Alright. And other foot. Okay. So, edema. Nope. And forefoot here. Looks good. Toes. Normal capillary refill. And the bottom of the foot. Yeah, that looks good. Okay, you can put that down. Alrighty, so let's just jot that down. Very good. Alrighty, so let me take a peek if you're due for any screenings at all. Okay, no, looks like you're pretty much up to date. We don't need to look for anything like cancer or anything of that sort. So we don't need to schedule any testing. Okay. And let me look at your vaccination records, make sure that's up to date. Yeah, you've got a while before we need to do any updates. So that's great. Now, I did see here that we have kind of been monitoring a couple of your levels for a while. So we will want to do a couple blood tests, I think. Looks like mostly vitamin D. You've had a bit of a history of low vitamin D. I want to make sure that's in a good spot. And iron as well. A bit of anemia. So we'll get those ordered. And I'll print out a little sheet so you can get that taken care of. So we are going to do normal blood panels and iron. I'm going to get the ferritin here. Just to cover our bases. So. Good. That will get all ordered. Do you have any questions for me at all? Looks like you are all cleared for the next year. I don't see anything we need to monitor besides those couple of vitamin and mineral levels there. Okay, very good. So I'd like to thank you so much for coming in and getting your checkup. I'm glad we are able to keep such excellent records on this. I hope you have a whale of a day and a good rest of your night. Thank you. Thank you so much for watching. I really appreciate it. And a big thank you to my patrons on Patreon, without which I wouldn't be able to make these videos. If you'd like to help support the channel, I have a link to my Patreon in the description box below. I offer perks like trains, early access to videos, ad-free access to videos, Patreon exclusive videos, audio downloads of all my content, and not that many trains. I hope you have a whale of a day and a good rest of your night.